Okay, it's Regan Archibald here again, and let's talk about phase one and phase two of your care plan. So, assuming you get accepted for care, and by the way, we work with A students, we work with B students, we can't work with C students. And I'm going to talk about what that means throughout the course of this video so that you can make sure that you know that there's going to be some work on your part as well. I mean, it's going to require you to show up and to have, proper nutrition, and there's going to be some cool things that we'll cover, and I'll explain that today. But number one, when you come in and we start care, the very first thing our team does is we meet together and we figure out the right course of action for you. And so the first thing we're doing is we want to remove inflammation and get you out of pain as quickly as possible. And in some cases, we do that within days. The second phase is where we put together the next phase of care, which is the reparative phase. This is where we look at the foundational structure of your body and we identify where the repair needs to take place. Because how many of you have put on decades of stress to your body and you've never really stopped and allowed your body to heal? So we're going to come in there and we're going to repair what's been damaged. And then the third phase is the rebuild and regenerate. And this is an exciting phase because the regenerative phase, it never ends. And so it's similar to doing a remodel on a house. The very first thing that you do is you have to remove the things that are no longer necessary. And so then sometimes, as you're cleaning out the garage or a closet, things get worse before they get better. That's phase one. Or if you have a house fire, you've got to put the fire out before you'd ever start fixing it. Imagine if a team of contractors came in and they start constructing new walls when the house is still on fire. It doesn't make sense, right? So that's what gets missed in a lot of medicine today is, they either focus just on doing a steroidal injection, let's just put out the flames, which sometimes can be very necessary. And we'll talk to you about that. But in many times they go into the reparative stage too soon. So they're not doing the things to get the inflammation down. And then you go to repair it too quickly and the inflammation and the fire just starts up again. And you've got this brand new rebuild, but it gets burned down. So then we go to repair. We fix and correct the problems that were caused by the damage, by the fire. And then we start to remodel the inside, make it beautiful and better than ever. But as we do this, we focus on 5 core pillars of health. And these 5 core pillars of health are nutrition and gut health, fitness and exercise, hormones, brain health, and detoxification. So one of the things that we are going to invite you to do and encourage you, and this is what we include in every one of our pain reversal programs, is a functional blood chemistry panel. Now you may be saying, well, Regan, but it's my knees and my back. What does that have to do with my blood chemistry? And why do you want to pull out my blood? And so I understand where you're coming from, but the biggest reason we do this is so that we don't miss what's going on inside your body. Because if you look at your joints require proper blood supply. And that blood supply brings nutrients to the area. That's what hydrates those discs in the space. And if you've got issues in your blood, then that's going to create more inflammation. And the more inflammation you have, the harder it is for your body to heal. So when we look at your blood chemistry, even if you say, well, I've had a physical and everything looks normal. Well, I'm skeptical about things being normal in your blood until we look at it from a functional blood chemistry perspective, because the blood ranges are based on 90% of the population as if they're healthy. But unfortunately, 90% of Americans are not healthy. In fact, about 65% of us have at least one chronic disease. And so as we go through your blood labs, we can look at things from an optimal range. So we'll say, okay, there's no colors that show up, you look good. We look at it from where things start to malfunction. So, it's kind of like going through a stoplight. The yellow markers let us know that you need to push on the gas or hit the brakes. The red is when you're about ready to get into an accident. That's when disease patterns have built up in our body. And the pink is when there's a severe problem. Many of us have been taught that pain is the problem, but pain is actually only the manifestation of an underlying disease and malfunction. And the problem with most pain management specialists and pain clinics and even holistic clinics is they just focus on the pain, but they don't look downstream. And by looking downstream, this is where the functional blood chemistry becomes a key component to your overall health. And so imagine if you actually knew what your vitamin levels were. I mean, this particular patient was 100% depleted in vitamins. 88% depleted in proper fats, not hydrated, so 60% dehydrated. 38% of carbohydrates were being consumed and only 29% of the minerals that her body needed. And then she needed about 20% more protein. And so, would you agree with me that diet and nutrition is an important part of health? And would you also, have you noticed that when you go to most clinics, this is not talked about? So we want to place a big emphasis on your care around you getting the right food in your body so that your body can actually heal. And I can tell you that there's no other way that I know of where you can correct the problem for good. In fact, we did a clinical study and they found that just by getting a patient eating more vegetables and getting rid of sugars, allowed pain to reduce by 50%. So this gets you 50% of the way there. That's impressive. The other thing we're going to do is the proper testing. So we do medical exams, we look at postural assessments, we'll do a TCM examination, and I'll explain what that is. But when you come in, we want to make sure that no stone is left unturned and that we really get to the root cause of this. So in our examination, we'll be palpating your spine, we'll be looking at areas of damage, looking at your knees, looking at your shoulders, everything that's necessary in order for us to get the proper diagnosis. And then once we have the proper diagnosis, then we treat it based on those 5 core pillars of health. Then there's going to be fitness and rehab. So we do expect you in many cases to do some work at home. We have weekly HAT challenges. So these health accelerator courses that we'll give you access to. And so you can get enrolled with our entire community and learn how to take care of your own health. With your acupuncture care, acupuncture, chiropractic care, physical therapy may be part of your program. But one of the things that we do is we'll listen to your pulse, look at your tongue so we can get an accurate assessment of where the blockages may be. And then one of the novel therapies that we do in our 3 phases of care is we use peptides. Now, peptides, you're saying, what are peptides, Regan? I know I can put it on my skin, but yes, and peptides have made massive media headlines just for the fact that they can get rid of wrinkles and they can make you look more vibrant and youthful. But if you look at peptides, there's peptides that we use internally. And some of these peptides, like thymosin beta-4, have been shown to trigger the release of healing properties in your body, like stem cells. They can also reduce scar tissue, improve flexibility. Thymosin beta-4 also has potent anti-inflammatory benefits. I notice when I use thymosin beta-4, I recover much quicker from my workouts. Other peptides that we do to help support your structure are we use peptides to improve your body's own ability to make growth hormone. Because I don't know if you're in your 40s yet, but I am. And I can tell you that recovery is a big key. And so using thymosin beta-4 and then using these growth hormone secretagogues or growth hormone releasing peptides, we've actually seen our patients be able to reverse aging at the same time, because a lot of pain comes because we get old, right? So I don't think age is the problem in joints. The problem in joints is that we don't have enough growth hormone to keep those joints healthy and to recover. And so that's what happens as we age. So we're going to help reverse the clock with some of these growth hormone improvements. We use peptides called CJC1295 with ipamorelin, or there's another favorite, and this is a big time favorite of our patients, which is called sarcotropin, ipamorelin, because it helps the brain, it helps the bones, it helps the joints, and it also helps you build muscle mass. And it also might help you increase some fat burning potential too. So big time healing that happens with these peptides. What we do is remove all the barriers to healing so you can have a regenerative effect in your joints. Because what we found is in the joints, as they start to deteriorate, if you don't use the right treatment strategy, your joints will never recover. And so what we'll do on the next phase in the next video is I'm going to share with you some of these novel injections we do to help maximize your body's own cellular health so you can regrow cartilage, tendons, ligaments naturally without drugs or surgery. So I'm Regan Archibald. I hope this is interesting. We'll look forward to seeing you in the clinic very soon.